Elizabeth, as you know,
Yeah.
my mom was a therapist.
Yes.
And when I was younger, we used to have this debate all the time. Tommy Lasorda, famous Hall of Fame Los Angeles Dodgers manager,
Okay.
who had some star players who had some serious substance abuse issues.
Okay.
And Tommy Lasorda used to say, "It's not a sickness, it's a weakness." And I used to ask my mom about that to get her point of view, and she could not disagree more. What are your thoughts on that?
Well, that's a very controversial question, because if you talk to people who come from a more traditional approach in therapy, or people who are trained in the addiction field specifically, they believe that addiction is a disease. They believe that it's a disease of the brain, and that's how they train counselors to look at addiction as a brain disease. I personally don't necessarily agree with that. I think that if you give addiction too much power over you, which the addiction specialists say the addiction has power over you, but I say you can have power over the addiction. And you put your mind to something and you commit to wanting to get clean and quit, you can. You can't just say, oh, it's a disease and there's nothing I can do about it. It may be a limitation. It may be something that you'll always be vulnerable to, or that you may struggle with, but I believe that it's ultimately mind over matter, like with any disease. It's very controversial, because if you dare say in the addiction field that you don't think addiction is a disease, you are going to get attacked. So people have tried, there's been a movement in this country in the past maybe 10 years of people who are trying to come up with other treatments for addiction, because all that's out there is the disease model, is to look at addiction as a disease, and they have gotten literally accosted at public conventions. I mean, in AA, the disease model for addiction is actually not that successful. It's like, I've heard 4% successful and 11% successful. That's not great. So I would say that we're not doing something right in the way we look at addiction. I would say Lasorda might have a point.
It's refreshing to hear you say that. It's non-traditional.
Very non-traditional.
Most therapists would probably have a different answer to that. I've known you for a long time, and I think those two words, non-traditional, really describes you. What does that mean to you in terms of the way that you run your practice?
Well, Doc, I think when people think of going to therapy, they have this idea that they're going to be in this very cold clinical setting with somebody with glasses and a suit and tie, scripting notes and diagnosing them and judging them and kind of putting them on the spot. And I think people believe that when they go into therapy, they're going to go meet with a professional who's going to basically tell them that something's wrong with them. So that is not at all what I do in my therapy. So I call it non-traditional, although there are probably a good amount of therapists that practice somewhat in the way that I do. But the setting where I do therapy feels more like home. My office looks like a living room. I'm very friendly. I try to be very warm. And I don't look at people as necessarily having a problem inside of them. I like to look at people's relationships and see what outside forces might be influencing them, or influencing the way that they think, or influencing their relationships. And I dress very casual. I don't take a lot of notes. I typically don't diagnose unless it's really necessary, or unless I feel it would be really helpful for someone to kind of understand what it is they're dealing with, because sometimes diagnostics are helpful. If you don't understand what's going on, how do you treat it? So sometimes there's a time and a place, but generally speaking, it's not what I do. And I just try to be very relaxed, very integrative. I tell my clients, if you disagree with me, tell me. I want my clients to have a strong voice, and I want them to be able to build a very strong relationship with me, because if you build a strong relationship with me in therapy, chances are you'll be able to take what you've learned in this relationship and do it in all your other relationships. I kind of like to think of myself as the girl next door that you're coming to hang out with when you come to therapy, but a girl next door who has 4 years of graduate school and extensive training in this particular field.
Other cultures seem to embrace therapy and talking to somebody about what's on your mind. But yet, here in America, it almost seems like it's taboo to discuss it, or if you see a therapist, you really don't want other people to know. Why do you think that is?
That's true, and that's a great question. And I don't know if I have exactly the answer, but what I can come up with is I think American culture is a culture of strength. We are a fighting culture, we're a strong culture, we're hardworking, and we push through things. We're not really a culture that sits down and talks about our problems. We fight, everything in culture is the war on drugs, the war on terror, the war on violence. It's almost doesn't make sense, but we're a culture that I think values strength and being tough and being strong, and we're not really a culture that values talking about hurtful feelings or tough times, because we push through it. And I think that there's something really wonderful about that. I don't think that that's all bad, but I think we also then become somewhat of a repressed culture where, everybody has pain, everybody has problems, everybody has issues in their relationship, no matter how healthy you are or your relationships are. And what's wrong with coming to talk to a totally objective party, somebody who comes in without any bias about your life and acts as a sounding board to kind of help you become even better. I also think part of the American culture's problem today is technology and consumerism. And I think technology has become a huge barrier for human relationships. And I think that it's sad. I think we spend more time on the internet or watching TV or playing video games than we do just sitting down like this, two people looking in each other's eyes and having a real conversation. That seems to not be so valued anymore. I lived in Europe briefly, and I felt that in Europe, conversation, making friends was very, very valued. We're here, we're in a hurry, we're in a rush, we have to get to the next meeting, we can't really stop and get to know people. So the idea of coming to talk to a stranger about your issues to American culture seems, I guess, really unconventional and really not the norm.
Interesting. We've talked in the past that you run your practice via some principles known as the postmodernist theory.
Yes.
What does that mean to somebody who has never seen a therapist before and maybe considering coming to see you?
Okay, so postmodern theory is based out of postmodern thinking or postmodernism. Postmodernism is a way of thinking that basically says there is no absolute truth. There is no right and wrong. There is no good or bad per se, unless we're maybe talking about virtues. Whereas modernist therapy, which is more psychoanalysis, when you think of Sigmund Freud or you hear the term psychotherapy, that ideology thinks that there is a way to be healthy in life. There is a way to have a healthy relationship. There is a way to be good and a way to be bad. Well, I come out of a very postmodern program. Barry University is all about postmodernism, and they sort of reject the modernist view. So I come to the table with no assumptions about what's right or wrong for you. And I think that takes a lot of pressure off of clients, because again, I think people think they come to therapy and they're going to be told, well, here's the right way to do things, here's the wrong way, and if you're doing this, you're bad or you're wrong. So I think postmodern thinkers in general, I think we have a much more open mind, and we look at the client as being the expert on their life, who's sharing with us in collaboration what's going on in their life, and together we sort of come up with a solution or a resolution or a different way of doing things. Postmodernists don't come in saying, this is how you live a life and this is how you do not live a life. We come in saying, there's many ways to live, let's see which way is best for you.
I know that your client base is very diverse.
Yes.
But if I were to ask you who your perfect client is,
Perfect client, okay.
who would that be?
Well, a perfect client would be anybody who really wanted to, I guess, improve their life and really was interested in doing the work that it takes to change or to make those improvements. Someone who's open-minded. But I don't know if there's really a perfect client. I think that I like challenging cases, so I don't mind if people come in maybe even being skeptical about therapy or thinking therapy is sort of useless or a joke. And I've had that experience, and I like to change their mind, and I like to know that someone who came in completely skeptical and who did not believe in the process actually walked out of a first session saying, wow, I really got something out of that. This wasn't so bad. We laugh in therapy sometimes. It's not always crying and talking about sad things or talking about horrible things or tragedy. It can also be looking at your strengths and what's great about you, and how do we highlight that and make that even a bigger part of your life. So I'm open always and willing to work with pretty much anybody as long as it's in the scope of my competence, and I'm up for a challenge. So I've had it happen where especially teenagers, when I've worked with teenagers, I've had teenagers come in and literally refuse to speak to me for session upon session. So that was extremely challenging for me, and so I realized that I sort of go where they are. Okay, they don't want to do therapy, they don't want to be here. So I say, okay, well, what would you like to do? You want to watch a movie? You want to listen to music? Let's just hang out. And usually by doing that and connecting with them where they are, instead of forcing them to talk to me or forcing them to talk about something they don't want to talk about, we connect as friends, and then the therapeutic relationship can begin.